you testified on Wednesday about the impact of the pandemic on insurance coverage. It makes sense that it makes sense that potentially the uninsurance rate would rise because of the recession caused by the pandemic. But what does the data tell us?
So it's pretty interesting. Remember that we lost 22 million jobs in March and April. We lost 20 in April alone. And at the time, many people, myself included, I wrote a short paper with Tom Lee about sort of the potential for insurance losses because of those layoffs. So about half of those layoffs would have been on employer-sponsored insurance, roughly. And so you can imagine the upper bound being 10 million workers potentially losing their insurance. And that's an enormous disruption. There are about 30 million people without insurance, 26 going into the pandemic. And so, you're picking up something that looks like a third, and that'd be a big problem. Now, anyone who was on individual coverage already in the Affordable Care Act marketplaces or on Medicaid or, Medicare, a layoff doesn't affect their insurance status. So it's really the employer-sponsored insurance crowd. And lots of people did estimates. And we've seen estimates as high as 27 million people from the Kaiser Family Foundation, estimates down around 5 million from the Economic Policy Institute. And so everyone's sort of looking. As it turns out, people who lose their insurance have some other places to go. Like many people might have a spouse who's insured, and they just simply switch to being covered by their spouse's insurance. You can go to the Affordable Care Act exchanges and go buy an individual policy, things like that. So we really do need some data to resolve what actually happens on the ground. In what I think is just a fantastic experiment in real time helping policymakers, the Bureau of the Census started in April something called the Household Pulse Survey, and every week they do online this sort of surveying of households, their employment status, their earnings, whether they've diminished earnings, and all sorts of aspects of their lives, food and nutrition, and health insurance. So we have these questions that ask, do you have health insurance or not? Where do you get it? Private, public? And that started in April, late April 23rd, I think. It's continued through August 31st. That's the most recent data. And if you just look at the endpoints, beginning and end, what you find out is the fraction of the population that's uninsured has gone down by 0.6%. And that's taken it at face value. I think the better interpretations is it's sort of noisy weekly data and it's a new sample. It looks roughly unchanged. Like there's no drama out there because of the pandemic. And that's a pretty surprising result.